What we'd like to do for just a few minutes here is if we have a few volunteers that'd like to share something innovative that might have come up in your conversation or, or that are still coming up in your conversations. Would anybody like to be our first volunteer to share? All right, we have a volunteer. Thank you. Malcolm is going to share.
Just to get the ball rolling, and we talked in the very brief time, Catherine, that you gave us to talk.
Blame Umber.
We could have been much more incisive if we'd had more time. But we talked about stakeholders and the importance of including all the stakeholders, from those who are traditionally the visible ones to those who are traditionally the invisible ones. Yeah. But it's usually the invisible staff in an organization that actually make the place function. So we would traditionally look at health professionals, but it's the staff beneath the health professionals who really do the work, who run the clinics, who clean the rooms, et cetera, et cetera. And then, of course, looking externally, we talk a lot about how important it is to involve the external community that we're there to serve as health organizations. But cynically, I'm afraid, apart from wealthy individuals who we pop on the board for their money, frankly, it's not a common practice to really include surveys and opinions and input from the community, the people who really make up the community that we nominally serve. So we talked about stakeholders and inclusivity being an important issue.
Excellent. You guys did great in your short time.
Other people at the table who...
Oh. Go ahead.
Okay, so we talked about a design pathway and that it's really important to have a systems thinking approach, and that would include the whole health ecosystem and all stakeholders. And then we also talked about, there's been a lot of conversation the last couple of days about the individual, the system, the individual, and the design needs to include both. And in both, not an either or when it comes to resilience and well-being. And that we also want to, our design pathway would focus on the extreme pain points, both of the individual's response and also the organizational, so we can do that dynamic balance between all of them as we move forward.
Excellent, excellent. I think you have time for maybe one more. Anybody over on this side of the room? We haven't heard from you. Everybody's looking at the floor. Okay. All right, thank you. Go ahead, table 6.
Hi, this is just something I brought up with our table. I'm here at the National Academies, and we recently underwent an external review about different issues and how we can do our job better. We're not a health education workforce here, but we do our education in some ways. But something that came out was that that our external stakeholders, the people that use our products and want our products, want them cheaper and faster. But internal resiliency depends on our staff here, and our staff work on it's all soft money, it's all sponsor based. So if you do something faster and cheaper, that means that you have less job security, because instead of every year when you have to find something else to work on, every 3 months you might have to find something else to work on. And if there's nothing else to work on, then you can't stay employed. So it's interesting. I think it can happen with all sorts of, if your patients want greater access to services, then that puts stress on your providers, right? Because so your external stakeholders often will impact the resilience and the wellness of your workforce, and how do you get that balance? So we're just starting the process. So if we fix it, we'll let you know.
Great. So these are great examples, I think, of the complexity of the systems that we're talking about, and how we really need to have an expansive focus that includes the individual, includes the system, and includes an external system as well. So great thinking. David has just a couple more remarks he's going to make before we close out this session. So thank you.
Yeah, thanks for the comments. And I think that they're great examples of the systems level thinking. It's not an either or. It's not an individual or organization. And it's the stakeholders is a great comment in particular about the invisible ones, the ones we don't think about. I went to business school as well as my psychology degree, and in business school, you're taught typically that your ultimate goal is to maximize shareholder return, right? And everything follows from that. And we know that that's not true. I mean, as the psychologist part of me says that we've seen plenty of examples in the environment where that does not happen. It does not trickle down to employees. And so I think the new model, which gets at the stakeholder element, is it's not about maximizing shareholder return, even in a for-profit organization. It's about optimizing stakeholder value. It's all of the key stakeholders and how do you get the best outcomes possible for all of those parties. That's the workforce, that's the organization, shareholders if it's a company that it's set up that way, the communities that the organizations are embedded in. And thinking about from that perspective, that yes, there are trade-offs with these various initiatives and approaches, but your ultimate goal is to get the best outcome possible for all of the major players that are in the mix. So just in wrapping up, one of the things we do at APA in our Psychologically Healthy Workplace program is organizations can apply for our award, and they go through an evaluation process, and we provide feedback they can use to learn in there. And then one of the things we do is we compare the data from our winning organizations each year to the benchmarks of the national averages to see, are they indeed outperforming national averages in terms of well-being, in terms of organizational functioning and performance. And every year, no matter what the industries are, and we've actually had a lot of healthcare type organizations in the mix and a lot of nonprofits in the mix as well. So if you check out our website, all the case examples are on there. You can find lots of hospitals and hospital systems and other healthcare organizations with examples of how they're doing these kinds of things if you go dig around on there. But for example, this is the type of thing we do each year. We compare the winning organizations. The green bars represent our 2018 winners. The blue bars represent U.S. average. And so these are some of the measures. We compare a lot of other ones as well. But you can see turnover intent, chronic work stress, the reputation of the organization, would they recommend it as a good place to be? Are they motivated to do their best? That when organizations are collectively doing all these things, they are outperforming national averages pretty significantly year after year, even in industries that don't always have the best looking numbers. We've had quick service food organizations, some healthcare organizations where there's a lot of churn and things like that. We still see these kinds of splits year after year. A reminder that there's no one way to do this, that design thinking framework. You have to figure out how to craft something that's the best fit for your particular organization, for your members of your organization, for the clientele that you serve, and do what's going to work best. And when that happens, that's what's going to meet those unique needs and get the best possible outcomes, not just an off-the-shelf solution from a vendor, and not just, I saw this organization over here do it, and I'm going to try to replicate it here, which it might not be the same characteristics and factors. Ultimately, it comes down to a socioecological approach to promoting health, well-being, resilience. And we spend most of our time and attention here, but just like the other model, look at the tiny piece that intrapersonal, that individual level intervention and resources actually affects. That's not going to be effective unless you have the supports from the organization, from the community, unless public policy is supporting it. Another reason why our organizations have to go out and promote and support good public policy that's in the service of the well-being of our communities and workforces. That's going to support all those individual level efforts and make all of that all the more effective. So don't just focus on that tiny piece of the pie. You might need to intervene at multiple points in those circles there to get the most effective results. So don't limit yourself. And I'll close with one of my favorite quotes, which is from the Indian philosopher Krishnamurti, who commented that it's no measure of health to be well adjusted to a profoundly sick society. Well, let's sink in for a minute. It's no measure of health to be well adjusted to a profoundly sick society. And you can take that at the societal level, but it applies at an organizational level as well. If you're truly looking to promote well-being and resilience, the outcome you're looking for is not, can someone withstand a terribly dysfunctional, negative, toxic work environment? That's not success. You need to change the environment at the same time. So thanks very much.